Hi everyone, I'm Dr. David Bernstein, and I wanted to welcome you back to our series, 25 Tips for Working with Modes. Now, last time you learned how to amplify the music of the modes, how to reach patients' emotions and intensify those emotions when they are emotionally detached. And today we're going to turn to what is probably the most important topic in this entire series, and that is the topic of being genuine, being authentic in our relationships with patients, whether we're talking about a therapy relationship or a relationship with a patient on a ward. The most crucial thing is to be ourselves. And this sounds kind of like a truism, right? Everybody says, be yourself. But what exactly do I mean by that? What I mean is that, when I'm with my patients, I want them to get the authentic me. I want them to experience, who I am, my qualities. And I want their experience of me to be basically the same that, my family gets, or my friends get, or my students get. In other words, I want to be the same me, no matter, who I'm with. And, why is this important? Because when it comes right down to it, a therapy relationship boils down to two people in a room. Okay, so when we strip away all the, techniques and technical aspects of therapy and all the theory behind it, it's essentially an encounter between two human beings. And whatever the differences are, between us and our patients, our backgrounds, or how we're put together as people, underneath that there is this kind of, common humanity, that we're all human beings. And what is that experience like, of being together in a room? What is my experience of the patient like? What is his or her experience of me like? And how does it feel to me, when I'm in the room with that patient? Now, why is this so important? Well, maybe the therapy relationship isn't so critical if we're, doing short-term therapy when somebody comes in for a very specific kind of, problem like, an anxiety disorder and so forth, or depression. If we're doing short-term therapy, maybe we can focus more on the technical aspects of the therapy. Now, I'm not saying that the therapy relationship isn't important there, it certainly is. But when we're talking about people who have more long-term problems, where their problems are more rooted in problems in their attachment relationships growing up, then in that case, it's even more important that we're able to be there for them. And here, there's this concept in schema therapy and in SafePath, this team-based form of schema therapy that I developed, called limited reparenting. And that means providing for what some of the patient missed growing up, for what some of his or her emotional needs are, the things that didn't get fulfilled growing up, in the therapy relationship. And how we, quote, reparent a patient, how we are there for a patient, how we provide for that patient's emotional needs is essentially an extension of who we are. We're all different. We're as different as therapists and we're different as people. And some of us may be, more outgoing, some more reserved, some more playful, some more serious. But we can all do a good job of being there for our patients and providing some of what they miss growing up, if we can be genuine. If they can experience the real us, the real me. Okay, so that is really what ultimately is one of the things that's healing for the patient. That if they can form a genuine attachment to me as a real person based on my real qualities and their real qualities, that's something that can be very healing to them and really make a long-term difference in their lives. Okay. Now, it all sounds good, right? So, I'm true to myself, I'm authentic, I'm genuine, the patient reacts well to that, and all is good. But we know that in reality, that's not how it always happens. And we know that there are some patients with whom we feel more comfortable, we have a good click with them, and then it is actually much easier to form that kind of genuine, caring relationship. But what happens when we encounter patients who have more severe modes? Like let's say that, this is the side of the patient that you often have in the room with you. What is it like to be, two people in a room together when this is the side of the patient that you're usually encountering, an angry protector mode, a mode that is very mistrustful and is, keeping you at a distance and sending you all kinds of nonverbal signals that says, I'm angry, stay away from me. How do we be genuine? How do we be real when we're encountering this mode? Well, it's a lot more difficult. The reason it's difficult is because, this mode pushes us out of our comfort zone. And then that may trigger certain things inside of us, feelings of, insecurity or inadequacy. Maybe we are confronted with aspects of ourselves that, we didn't know about. Or maybe we're confronted with aspects of ourselves that we did know about, but we don't feel very good about. And so, how do we deal with that? Because nobody likes, not feeling that they're, at their best, that they are able to be their best selves. And certainly when we're confronted with more serious modes, we often don't feel like we can be our best selves. So what do we do about that? Well, what I suggest is that you take an attitude of crisis equals opportunity. That, one of the positive things about our profession, one of the very best things about our profession in mental health, is that it gives us an opportunity to grow. And sometimes it's the patients who push us out of our comfort zones the most that give us the greatest opportunity to grow as human beings. Because we are forced then to take a look at certain kinds of things in ourselves. Now, I'm not saying that that's an easy process, but what I am saying is that it's very important. It's very important in terms of, you're being able to work with patients, that you be able to, when a patient takes you to some difficult place, that you have some idea of what that place is all about. And even better, if you're able to, work through or reprocess some of the emotions, that you encounter when you're in those, difficult moments with your patients. So what I'm suggesting is, to take advantage of the crisis that some patients may pose for us when they leave us feeling so uncomfortable. And to try to engage in a process of, fearless self-examination. Because it does take a certain kind of courage in order to look at ourselves. It takes also courage for our patients to look at themselves. And it takes courage for us to look at ourselves. Now, how can we do that? Well, certainly supervision helps. It can really help to, incorporate some self-examination, some self-reflection, into your work in supervision. But sometimes it's a matter of going deeper. Sometimes it's a matter of, getting therapy for oneself. And, if you haven't been in therapy, nobody takes that step easily. Usually people go to therapy when they're in some kind of crisis. Now, I had the experience in my, 20s of dealing with some severe anxiety symptoms myself. And I can tell you that that was no fun. But it did force me to go into therapy. And in a sense, that's the best thing that ever happened to me. Because I had some baggage growing up, as a lot of us do. And it was something that, I probably wouldn't have looked at otherwise. And so, it started me in a process, what's really been a lifelong process of, self-examination and really trying to work through what my various issues are. And, that's really helped me a lot as a human being, and it's helped me a lot as a therapist. And again, I'm not saying that that process is easy. Many of us are hesitant to go into therapy, and particularly we may be hesitant to go into therapy if there is no big crisis, right? Let's say you're more or less well-adjusted in your life, things are going okay. But again, when we're pushed out of our comfort zone in therapy, it may suggest that there are certain areas that we're not aware of, or maybe we are aware of, we haven't wanted to really take a look at them. And it can provide an opportunity for us, again, to grow and to change to the benefit of ourselves and to our patients. Okay. Now, today we talked about, the importance of being ourselves, what that means, what its implications are for therapy relationship. And of course, when we talk about the topic of being ourselves, it also raises a lot of questions about, well, to what degree can we share things about ourselves, even personal things about ourselves in the therapy relationship? When we're talking to our patients, what do we choose to share and what do we choose not to share? And that will bring us to our next topic, which is share it. And finally, I'd like to invite you to come to our website, www.imodes.com, and take a look at our image-based therapy tools. And if you have any questions or comments regarding today's video, please feel free to put them in the comments boxes on Facebook, and I would be very, very glad to respond to them. Okay, have a great week and see you next time.